safety, which might include shifting the patient from an unsafe place to a safe place. Check for responsiveness. Tap the shoulders with both hands and ask loudly in local language. Are you okay? Are you okay?
Look around and ask a person to get the emergency kit and the AED, call for an ambulance and activate the emergency.
If no one is available, you can use your mobile phone to call the local helpline number and activate the emergency response system. In India, the local helpline number is 112.
While help is on the way, check for the carotid pulse. The technique of feeling the carotid pulse is feel for the trachea at the center. They slide 2 to 3 fingers aside of the neck. Simultaneously, check for the breathing by looking for the chest rise. You should finish this in 5 to 10 seconds.
If you observe no breathing, abnormal breathing, or only gasping, patient is not moving, and you do not feel a pulse, start chest compressions immediately.
In the first few minutes, the oxygenated blood is in the circulation. So we start always with the cardiac compression. For a layman, this is sometimes difficult to appreciate the carotid pulse. So if the breathing is absent and the person is unresponsive, immediately again you start the cardiac compression.
The delivery of effective chest compressions is a priority, but if an AED is available, use the AED as soon as it is available. AED, or automated external defibrillator, is a lightweight, portable device designed specially for use by a layman. This device, when attached to the chest, can identify the abnormal heart rhythm like ventricular fibrillation, which can be treated by giving an electrical shock. This device can also deliver the shock, which will then convert the abnormal heart rhythm to a normal heart rhythm.
The AED uses voice prompts, lights, and on-screen display to guide the expert how to use it and prompt him. AEDs are simple to operate, guiding the lay experts and the healthcare providers to use it safely and efficiently.
In simple terms, AED is an intelligent device which, when switched on, starts giving voice commands. This AED, when attached to a victim's chest, can read and analyze the heart rhythm. This AED can also decide if that heart rhythm is also treatable by giving an electrical shock. If it finds that the abnormal rhythm is shockable, the AED will either deliver the shock automatically or will prompt the rescuer to deliver the shock by pressing the orange button.
AEDs are installed at public places like airports, metros, malls, stadiums, and many other places. Before you start chest compression, ensure that person is lying flat on a hard surface. Quickly remove the cloth and expose the chest, keeping in mind the dignity and the local cultural practice. We need to bare the chest because the AED pad has to be applied on the bare chest.
By starting compressions, you are initiating the CAB sequence of CPR. Compressions, airway, breathing.
Let us go through the steps of effective compression. Kneel down beside the victim.
Place dominating hand in the center of victim's chest, that is, lower half of the victim's sternum. Place the other hand on top of the first hand and interlock your fingers.
Keep elbows straight. Position yourself vertically. Pressure should be from shoulder and press the sternum at least 5 centimeter, but no more than 6 centimeter.
After each compression, allow complete chest recoil. Compress at the rate of 100 to 120 per minute. After you give 30 compressions, opens the person's airway and deliver 2 breaths.
Before giving breath, Open airway by using head tilt chin lift method. You can use a pocket mask if available or a barrier device. Mouth-to-mouth breathing can be given if you are comfortable or using a handkerchief. If you fail to deliver two breaths in 10 seconds, do not worry. Resume cardiac compression. This cycle of CPR should continue, and as soon as an AED or help is available, we should take the help of second person and use AED immediately.
AED operation has basically two steps. Step one is to switch on the AED, and step two is to follow the voice commands given by the AED.
The first rescuer will continue the cardiac compression, while the second rescuer will operate the AED.
Place the adhesive pads on the chest of the victim according to the picture displayed on the AED pads. Place one pad on the right side of the chest, just below the collarbone, and the second pad on the left side of the nipple, on the left side of the chest.
After the pads are placed on the chest and the AED is plugged with the pads, it will take around 10 to 15 seconds to analyze the rhythm.
Analyzing heart rhythm, do not touch the patient.
If a shock is advised, it will charge and then it will prompt
Shock applied. Charging. Stay clear of patient. Deliver a shock now. Press the orange button now. Shock delivered. Pain. If needed, start CPR.
And do not remove the AED pads or turn it off. Ensure that the rescuers change positions every 2 minutes, preferably while the AED is analyzing the rhythm. This would help in improving the quality of compressions and prevent rescuer fatigue.
the device will repeat and analyze the rhythm every 2 minutes and prompt the rescuer what to do. This cycle of 30 compressions and 2 breaths will continue, and AED will keep on prompting every 2 minutes, and such cycles will repeat till the help arrives or the victim becomes responsive.
Let us summarize the steps of CPR.
Ensure scene safety.
Activate the emergency response system and call for help.
Confirm cardiac arrest by three things: unresponsiveness, absence of breath, and absence of pulse.
Start high quality chest compressions immediately at the rate of 100 to 120 per minute, compressing at a depth of 5 to 6 centimeters.
Give 30 compressions followed by 2 breaths to be delivered in less than 10 seconds.
Never interrupt chest compressions for more than 10 seconds.
Use AED as soon as it is available and follow the voice prompts of AED for further CPR.
Continue the process of 30:2 compressions till advanced help arrives. By following these simple, basic life-saving steps, we can give the victim a chance to explore this beautiful world again.
Shade your inhibition and fear. Do CPR and save life.
व्यक्तियों का सुरक्षा कवच निर्मित होता है। इस मंत्र के
का कल हम लोगों ने एक लिंक भेजा था। 9:30 ये आपका एक हम लोग लिंक भिजवाए, हाउ टू ज्वाइन द CPR अवेयरनेस प्रोग्राम एंड डाउनलोड डिजिटल सर्टिफिकेट। तो उस पे ना एक लिंक आया हुआ है, दैट इज लिंक NBEM स्टेप 1 में है, वेब पेज पे दे रखा है netboard.edu.in करके। आप लोगों को आया है? आप लोगों ने रजिस्टर किया हुआ है ना? पे आपको लॉगिन करके, आपको जो रजिस्टर किया हुआ है ना वहाँ पे लॉगिन करेंगे तो तुरंत आपका ई-सर्टिफिकेट डाउनलोड हो जाएगा। आप लोग तो किए BSc पोस्ट BSc कैंडिडेट अभी आए, आप लोग के पास फोन है? ठीक है, आई विल शेयर दैट लिंक। तो उस पे आपको पहले रजिस्टर करना है एंड देन उसके बाद में आपको लॉगिन में जाके ई-सर्टिफिकेट वहाँ डाउनलोड होगा उस लिंक पे। ठीक है,
कंप्लीट हो गया क्या?